Welcome to the next era of intelligent ventilation. Have you ever imagined a critical care ventilator that could monitor your patient's physiologic changes automatically, make all the routine adjustments, and keep your patient in an optimized therapeutic zone from start to finish? This ventilation solution exists today. In the next few minutes, I would like to guide you through an introduction to IntelliVent, the world's first fully closed-loop ventilation solution, available only on Hamilton Medical's complete ICU ventilator, the Hamilton S1. Now let's get a closer look at IntelliVent. IntelliVent is the world's first complete closed-loop ventilation solution for automating adjustments of oxygenation and ventilation. With Hamilton Medical's current automation capabilities, only 3 control inputs remained: minute ventilation, PEEP, and FiO2. The development process has taken 18 years and has yielded a set of complex algorithms which work together to enable IntelliVent to completely close the loop on mechanical ventilation. It covers all phases of ventilation, from intubation through extubation, with the simplicity known from Hamilton Medical. It gives you evidence-based guidance in complex decision-making, and it visualizes complex information in an intuitive way. Now let's see a demonstration on how IntelliVent works. To start IntelliVent, you enter your patient's height and gender. An initial classification of the patient's condition allows you to tailor ventilation goals, but it is not mandatory. Then push Start. It's that simple. With IntelliVent, you can choose between manual and automatic adjustment of these 3 controls to allow for full automation or for scenarios where control of the individual inputs is desired. The automatic mode is indicated by the pulsing circles. At any time, you can overrule the settings by switching individual settings back to manual. While in the manual mode, IntelliVent will advise the user on which settings should be changed. While in use, IntelliVent gives you an intuitive way to monitor the patient's status and upcoming therapy adjustments. IntelliVent reduces complexity by graphically displaying the patient's status, current treatment, and required support in a single window. How does IntelliVent determine ventilation settings? Ventilation therapy is controlled mainly by lung status, CO2 elimination, and spontaneous breathing rate. Breath by breath, EtCO2 and spontaneous efforts are measured to adjust minute ventilation. The IntelliVent algorithms then determine tidal volume and rate according to lung physiology. Here in the ventilation horizon graphic, you see a current EtCO2 level of 46 mm mercury and the ventilation peak pressure of 28 millibar. The user is notified that the EtCO2 is within the acceptable range by both text and the yellow cross seen in the acceptable light blue zone, so minute volume will not be adjusted. The funnel shape of this acceptable range shows you that in cases where a patient's condition is more severe and higher pressures are needed, a broader range of EtCO2 is tolerated in order to avoid unsafe pressures. Now, how does IntelliVent decide on the level of oxygen therapy? Oxygenation therapy is controlled mainly by lung status and pulse oximetry. FiO2 and PEEP will be automatically adjusted to keep the SpO2 within an acceptable range. In all cases, the acceptable ranges for EtCO2 and SpO2 are set by default. However, the user may at any time go into the ventilator settings to adjust those ranges to follow their specific protocols. The funnel structure of oxygenation horizon is very similar to the ventilation horizon. Based on the major input SpO2, seen here at 90%, you can see a resulting PEEP of 6 millibar. As the yellow cross, representing the patient's status, is out of the tolerable light blue range, the text indicates an increase in therapy, simultaneously with the yellow triangle pointing upwards. For increasing oxygen therapy, IntelliVent follows the ARDS-NET protocol, as well as an estimated hemodynamic stability index to titrate PEEP in relation to inspiratory oxygen concentration. When applying decreasing therapy, the open lung protocol is employed, and FiO2 is decreased first while PEEP is reduced later, thus keeping the lung open. Severe septic ARDS patients often require high PEEP values and are often hemodynamically unstable. Increased pressures and volumes can further deteriorate their circulation. IntelliVent limits the maximum applied PEEP level to coincide with the hemodynamic status of the patient based on the HLI index. The HLI index is the heart-lung interaction, measured by an automated analysis of the pulse oximetry waveforms and pulse pressure changes with ventilation. Here on the screen, you can see Hamilton Medical's dynamic heart-lung visualization with the current status at a glance. This index is used to determine if the patient's cardiopulmonary circulation can withstand higher ventilation pressures. IntelliVent relies on non-invasive sensors for SpO2 using pulse oximetry and end-tidal CO2 for CO2. A newly developed reliability indicator for SpO2 gives you a quick visual status about the signal quality, so the user can verify that IntelliVent is getting the best input data. IntelliVent uses proprietary algorithms to interpret signals from multiple pulse oximetry sensors as well as mainstream capnography to produce filtered, artifact-free SpO2 and EtCO2 values respectively. These values are robust enough to adjust FiO2 and PEEP, as well as give you an EtCO2 value very close to PaCO2. Improved outcomes and patient safety are two of Hamilton Medical's core values. IntelliVent has successfully completed challenging clinical studies and worldwide tests over the last 18 years of development. Before I get into a more detailed explanation on how IntelliVent works, let's hear more about the outcomes and results. This is physician Dr. Mark Wysocki, Head of Medical Research at Hamilton Medical. Hi Mark, please explain why is it that I can trust IntelliVent to make the right therapeutic decision?
We believe we can trust IntelliVent to do the right therapeutic decisions in the patients for two reasons. First, because we are following the state of the art, the recommendations, the guidelines, but also because we already have clinical evidences showing that IntelliVent is doing better than conventional ventilations. Let me give you an example. When oxygenations need to be improved, we are following the ILS network protocol. And the change in PEEP and FiO2 are following this protocol. It has been shown that by using this protocol plus a low tidal volume in the most severe patients, the outcome can be significantly improved. Another example, when oxygenations is good enough and when the treatment can be reduced, then we are following the concept of the open lung concept, meaning decreasing FiO2 first and keeping enough PEEP for maintaining the lungs open. The second reason we believe that we can trust IntelliVent in doing the right decisions is because we already have today clinical evidences showing that IntelliVent is doing better than conventional ventilations. One study in France from Jean-Michel Annal and his group was comparing IntelliVent with manual adjustment of the ventilator in very severe patients in the ICU. And in this study, they found that by using IntelliVent as compared to manual adjustment of the ventilator, the patients spent more time with optimal ventilations as compared to manual adjustment of the ventilator. In addition, they found that the tidal volume, the pressure given by the ventilator were much lower with IntelliVent. Altogether, it means that IntelliVent is given a safer ventilation as compared to manual adjustment of the ventilator. They also found that gas exchange, arterial blood gases, were exactly the same with IntelliVent as compared to conventional ventilations, suggesting basically a more efficient ventilations with IntelliVent as compared to manual adjustment of the ventilator. Another study in Quebec, Canada, from François Lelouch and his group found in very challenging patients that by using IntelliVent as compared to conventional ventilations, again, the patients were spending more time with optimal ventilations as compared to conventional ventilations. In addition, they found that the number of manipulations of the ventilator were significantly less by using IntelliVent as compared to conventional ventilations. So Altogether, these two studies, including more than 100 patients, strongly support the fact that IntelliVent is doing better than conventional ventilation. Today, there is already some other studies running in pediatrics in different populations showing that IntelliVent is doing better than conventional ventilation. Let me give you some examples on how IntelliVent is adjusting the ventilator. Let's assume the entitled CO2 is too high, for instance 60 mm of mercury. See how minute ventilation is increasing. Now let's assume the entitled CO2 is too low and see how minute ventilation is now decreasing. Let's assume the oxygenation is not good enough, for instance an SpO2 of 88%, and you can see the FiO2 increasing immediately. If the SpO2 is good enough, now you have the FiO2 decreasing progressively.
Remarkable evidence. Does this mean that even in ICUs operating with low staffing levels and resources, IntelliVent can provide optimal ventilation therapy?
Yes, absolutely, and this has been proved. Definitely in developing countries, or when the expert in ventilation is not available, or when there is a shortage in resource, IntelliVent is definitely the solution.
Wow! And this could be even beneficial for countries like the USA, where intensivists and respiratory therapists are currently readily available, but with an aging population will experience future personnel shortages. Would you agree that in mechanical ventilation, 80% of all ventilator adjustments are routine, consuming a lot of time and requiring expertise at the bedside? Would you also agree that you frequently have many false positive alarms you have to attend to? In these instances and more, IntelliVent will change the way you ventilate your patients. Now we have seen how IntelliVent can help you by reducing the burden of routine tasks in mechanical ventilation and reducing false alarms, giving you more time and increased safety for your patients. IntelliVent automatically adapts ventilation and oxygenation continuously according to changing patient status. It takes respiratory monitoring, lung physiology, capnography and pulse oximetry into consideration and determines if the therapy should remain stable, needs to be increased or should be decreased. IntelliVent protocolizes therapy, which means you will always know what changes have occurred with the patient and ventilator settings. Just refer to the trend function. You can see the current status of your patient, their developments in the last 24 hours, and see if they are currently on track. While conventional ventilators deliver only user-defined breath to the patients, IntelliVent adjusts the ventilation and oxygenation automatically to your patient's changing needs by continuously monitoring lung mechanics and physiological status. Following such protocolized care may lead to a significant reduction of ventilator interactions, potential mistakes and errors. So, IntelliVent ASV provides less complexity by providing guidance in complex decision-making, by visualizing complex information in an intuitive way, and by implementing and supporting protocolized care. More time for your patients, by reducing the burden of routine tasks and adjustments, by reducing stress for the entire staff, and by increasing the time bedside staff can focus on patient care. Increased safety, by reducing the potential for mistakes and errors and the risk of escalations, by applying lung protective rules. The most advanced closed-loop control system, knowledge-based protocol rules, physiologic-based inputs and rules, both positive and negative feedback controllers, and patient-tailored therapy. So no matter how many ventilated patients or respiratory specialists your hospital may or may not have, IntelliVent ensures optimized, protocolized care all the time. With IntelliVent, everyone can provide state-of-the-art ventilation therapy. These are a few of the many good reasons to visit our website and learn more about IntelliVent and the new Hamilton S1. www.intellivent-asv.com. Download your personal copy of the IntelliVent ASV PC simulation right now, or call your local Hamilton medical representative today. Don't wait. Enter with us the next era of intelligent ventilation.